everybody. This is Mike Aaron Hersterbaumer from XTIVIA, Senior Business Development Manager. Joining us today, we have the VP of our CRM, Zach Bodine. Zach, thank you for joining us for another CRM Snacktime Snippet. So on today's topic, we are covering another Salesforce product, as we have done in the past, but this is a little bit different type of Salesforce product. As you may or may not be familiar with, Salesforce has really started to go into kind of a vertical methodology when it comes to rolling out their products. So they now have products that are built kind of out of the box, more industry specific. So things like Financial Services Cloud, Nonprofit Cloud, Manufacturing Cloud. There's others, obviously, as well, but those are some of the biggest. But arguably, the biggest vertical that they now have out there on the marketplace is one that we've gotten very familiar with over the last several years, and that's Salesforce Health Cloud. Now, when you hear Health Cloud, you may think, well, I understand what health is, but how does that fit? Because that is such a broad marketplace, right? And that's what's cool about Salesforce Health Cloud is, one, there's really so much functionality that comes out of the box that it actually needs to be kind of trimmed down for each organization. But the reason it's designed that way is because there are so many, if you will, micro verticals within healthcare, right? So hospitals, any other types of healthcare providers, pharmaceutical companies, insurance providers, medical assistance fund companies, right? Med tech is now it's what's called medical technology companies. All of these are just some examples of companies that we have worked with and companies out there in the healthcare space now that are leveraging Health Cloud or are starting to look at leveraging Health Cloud for so many different facets of their business, right? I know we plan on down the road because there is so much content on bringing more Snacktime snippets just focused on different types of use cases within this vertical alone, because there really are so many out there. So that's just kind of a little bit about the overview, but I'm going to pass it over to Zach now, because Zach's one of those guys that's been in the weeds of this product, right? So he knows a little bit and can tell you a little bit about, you know, how it was built, how it was designed. And again, just some of the things or reasons, things that we've done or reasons you might look to utilize the Health Cloud vertical.
So essentially all those different types of healthcare companies that Mike talked about, they all have customers or patients or end customers, and they need to service those customers. I mean, in a nutshell. So what Salesforce did was they said, you know, let's look at Salesforce as it exists today and what aligns the most with the healthcare industry that we already have. And that was Salesforce Service Cloud. So we already have cases, you know, anytime a customer reaches out to us, that's theoretically a request, which is, or an issue, which is a case. So they built Health Cloud on top of Salesforce Service Cloud. And then as a result of that, that spawned a lot of the additional enhancements that Salesforce has brought out as a result of this to make Service Cloud more robust and play well with Health Cloud. As an example, an insurance company would have a patient and they would submit an issue, which would create a case in the system. And then as a result of that case, they would open up a claim inside Salesforce. And then that claim would have a result, and maybe it would be paid out, and maybe it would not be paid out. And so then that result in another object. But that claim is related to some sort of medical issue, which could be I'm just getting into the nuances of this to kind of understand how the architecture of Health Cloud was designed. So they looked at a business and they went through a business problem, and then they dissected it and they basically said, okay, we basically need a custom object in Salesforce for every one of those nuances of that insurance process. And they basically built out Health Cloud in just that way. So you'll have purchaser plans, you'll have CPT codes. So every when you think of medical coding, every type of disease or reason you would need medical care is all falls under a medical code. And so they've created the architecture in Salesforce for you to track that, and which then allows you to make sure you're doing your HIPAA compliance and that you're also just tracking it correctly to know how you would cover that CPT code, and then what the payouts are for it. So they did this so comprehensively that it can really be used by a variety of different healthcare companies. And lots of times, a healthcare company will get Health Cloud, and each healthcare company that gets Health Cloud really is probably only using about 30 to 40% of Health Cloud's capabilities, because it's so robust and it's been designed for all the different types of healthcare companies that exist. So that's the great part about it is, you're a healthcare company. Today, you're only doing this part of the paradigm of healthcare. And so therefore, these are the architectural objects that you need in Salesforce to do that. And the nice thing is you don't have to try to turn Salesforce into Health Cloud by creating all these custom objects yourself and all the automation tied to it. They've already done it for you. You just have to decide, how does our business function? And as a result of that, what objects do we need to do that? And those objects already exist for you in Health Cloud. And so, like I said, lots of times that usually comes out to be like, maybe today it's only 20% of the objects in Health Cloud, which would still be a significant number of objects and things you need to track. But then your business can evolve. And the nice thing is then all those other objects and automation functionality already exists for you as a business to scale and leverage as you grow, and create more automation in your environment and make it easier for your agents to have a full comprehensive view of the patient when they call in or when they submit a case, to allow you to handle more claims volume with fewer agents to be more efficient as a business. So those are really a lot of the pros that Health Cloud has built, and why it's growing so quickly. And of course, it's on Salesforce, and everybody loves Salesforce, is familiar with Salesforce. It's user friendly, so it makes it really easy for adoption in all these organizations. And built on Service Cloud too, so you get all the great automation functionality of Service Cloud, such as Omni-Channel, Omni Supervisor, lots of functions within Service Cloud also. So that's
awesome. That's great. Well, thanks, Zach. That's a good specific kind of example or two to get people kind of thinking, right? How can it help us? So so that's just a little bit about Health Cloud. Check back in later because we're going to focus on some of the other industry verticals as well. And like I mentioned, come back and talk more about some specific use cases around Health Cloud. So, but if you're out there and watching, we really appreciate you taking some time to spend with us. Zach, thank you as always, and appreciate it, everyone. So come check us out next time for our CRM Snacktime Snippet.